friends, a very interesting note on how the Prime Minister's rationale, logic, and strategy works and transformation. Let me take the case of a healthcare transformation in India. Out-of-pocket expenditure can be devastating for poor people. A medical admission for a mild to a high-end surgery can set you apart by a few lakhs and push you into the poverty zone. In this context, what's been the strategy of the Prime Minister? Does he have an action plan? Does he have a vision? Let's have a look at it. From the year 2014, the moment he took over as the Prime Minister, he has been looking at transforming the domain with a multi-pronged strategy. What does this mean? He is looking at it from three different angles. Angle 1, which is a preventive. Angle 2, which is curative. And the prong 3, which is an enabler. Earlier Prime Ministers would probably just focus on one part of curative. The two, to what extent they were able to build scale or speed, we are aware. Unfortunately, the answer is negative. But Prime Minister Modi ensured that he is able to put a multi-pronged strategy in action. What does this preventive thing means? Very interesting aspect. The preventive nature of a healthcare means to ensure that you don't fall sick at all or prevent it to a very large extent. How a disease is caused? By an unhygienic surrounding around you, by a lack of good sanitation facility, lack of good potable water access. These are the three things that the Prime Minister looked at and brought in Swachh Bharat mission, brought in Nal Se Jal, and made sure that there was a Shauchalaya access for each and every household, leading to open defecation-free villages and urban spaces. While that has its own benefits in terms of, let's say, the dignity of women, when you're talking of building toilets or lessening their inconvenience, when you're talking of giving potable water access through the taps at home, the bigger impact, the second order and the third order impact is in preventive healthcare. People fall less sick because they have a good sanitation facility, they have a good access to potable water. And to top to this, the Prime Minister, through his own leadership, through his own personal activity, ensured that fitness becomes a mantra, Fit India becomes a mantra, yoga becomes a part of our lives, the Ayurvedic way of medicines, the preventive care medicines becomes a part of our life. What is it that he was trying to do? Try to stop the problem at its bud stage itself. A lot of people, if they were to get access to good sanitation, good healthcare, good facility in terms of Ayurveda, good facility in terms of yoga, you're preventing diseases. The fact that you are able to prevent disease in itself is a big achievement. That's prong number 1. Prong number 2, curative. If a person were to fall sick, notwithstanding all these things, or in the course of things, how do you address it? This is where the Prime Minister has been massively addressing it in a very, very big way. Double the number of MBBS seats available so that you have more doctors per population. Increase the number of MD seats. Increase the number of super specialty hospitals like the AIIMS in many parts of the country. The intent was very clear. We will build up a medical care facility to ensure that we are ready should there be a problem. This becomes the curative part of it. And if you were to take the enabler part, this is where the Prime Minister has been really, really impactful and effective. A poor man gets into poverty, further deep poverty, because of one ill health to a family member. Prime Minister ensured that the Ayushman Bharat scheme with 5 lakh rupees per family per year for about 50 crore people was something of a game changer. No more do you need to borrow loans. No more do you need to sell your lands or small pieces of gold to take care of your healthcare. Reduce the prices of usurious procedures. For example, a stent that would cost you 1.5 lakh rupees some 8 years ago now hardly costs you 30,000 rupees. That is the kind of an enabling that he brought in through the mechanism. Add to it digitization. He ensured that we all start getting our Aadhaar cards, Ayushman Bharat health cards, started getting the UHI, an interoperable system that allows all the stakeholders to share data with them. Access to data, preventive mechanism, curative mechanism, and an enabler. This is what made Indian economy a better economy because of better health. The proof of pudding is in eating. Give me an instance, is what probably you might want to say. Take the case of COVID vaccine situation. We brought in digitization so much so you were able to get an appointment for your vaccine on your COVID app, on your Arogya Setu app. 220 crore doses of vaccines were administered. What a fantastic infrastructure and logistic strategy. And where was the vaccine produced? In-house, within the country. India produced its own vaccine. Earlier, you would have to wait probably 20 or 30 years before you got the vaccines from other countries. But today, within a month of America launching its vaccine program, India launched her own vaccination administration. A massive number of 220 crore doses of an India-made vaccine administered in a very short span of time speaks eloquently of the kind of transformation that the Prime Minister has brought in. And a person who never stops at 90%, he peaks for, he urges for saturation. And that's where the saturation, be it oxygen plants, be it ICU facilities, be it super specialty hospitals and beds, the country is further geared post-pandemic. This is the change that the Prime Minister has brought in. Numbers, we can throw numbers. At the end of the video, you get to see the numbers where the achievements and the transformations can be quantitatively shown. Most importantly, vision is all about that qualitative mechanism. Trying to understand how do you eradicate the problem. And that's what Prime Minister has brought into the table. Have a look at the numbers, but most importantly, look at the logic behind the numbers and be thankful to Prime Minister Modi for his visionary step. Thank you.